Hello viewers, this video is on what antibiotics to take for chronic prostatitis. See, there's so many patients who are asking me about chronic prostatitis in comment section, and they're always asking me, sir, what antibiotic I should take. So for people staying in periphery or small villages, doing a semen culture test is also very difficult. So now, normally how we treat chronic prostatitis is, so chronic prostatitis, whenever we suspect chronic prostatitis, the main symptoms are frequency of the urine, testicular pain, perineal pain, suprapubic pain, pain in the lower abdomen, and sometimes premature ejaculation, sometimes frequency of urine, sometimes burning sensation in the urine, sometimes ejaculation, after sperm release, there is pain in the penis and below the testis, or sometimes close to anus, motion pipe. All these are called symptoms of chronic prostatitis, and we also call them as CPPS. CPPS means chronic pelvic pain syndrome. All these symptoms put together we call it as CPPS. So now what you have to understand is, now chronic prostatitis is an inflammation or infection in the prostate. There are three types of infections. So one can be bacterial infection, second one is fungal infection, and third one is viral infection. And if all three are not there, then we call it as either chemical prostatitis or non-bacterial prostatitis. So non-bacterial prostatitis is sometimes some people will have allergy to some kind of foods, then they get non-bacterial prostatitis. See, now if some people are allergic to alcohol, some people are allergic to smoking, some people are allergic to coffee. The moment they take coffee, they get prostatitis symptoms. So there are very few people with non-bacterial prostatitis. So for bacterial prostatitis, so now commonest antibiotic is doxycycline. Doxycycline 100 milligrams twice daily for at least 2 to 3 weeks will help. But if possible, see, now all these antibiotics are for people who can't do semen culture and for people who are staying in remote areas where they can't consult a doctor, or where they can't consult a urologist, or where they can't do a semen culture test. Otherwise, see, these are only trials. If there is opportunity, go to nearby doctor, get semen culture done, and actually you have to start an antibiotic according to the culture report. That is the ideal way of treatment. But if you are staying in a remote place where doctor is not available, or semen culture test is not available, and or you have to travel a lot to do semen culture test, then this video is for those people. So generally doxycycline will work for 2 to 3 weeks, will help in many patients. If doxycycline is not available, then low dose ciprofloxacin 250 milligrams or levofloxacin 250 milligrams for 2 weeks will help in chronic prostatitis once daily. Otherwise, if this is not helping, then we give azithromycin again 250 milligrams for 3 days. 3 days twice daily. So these antibiotics will cover most of the sexually transmitted diseases, and they will also cover most of the bacterial infections. Sometimes bacterial infections may be totally different, sometimes it may be Klebsiella, sometimes you may need antibiotic injections. Generally we don't suggest all those things in this video, because if your infection is very severe and if you have to take antibiotic injections, then it's better to consult a local doctor and take antibiotic. But if culture is negative, if you are in a place where semen culture can be done and semen culture is negative, then we have to suspect either it is fungal infection or it is viral infection. Viral infection, then their antibiotics may not work. You have to take anti-inflammatory medications like chymotrypsin, bromelain combination and medications for a long time, for at least for 1 month. So they will help in healing your chronic prostatitis. And another tip for chronic prostatitis patient is they have to ejaculate more frequently. The lesser you ejaculate, the higher the symptoms are. So some patients, they say, sir, whenever I ejaculate there is pain in the penis, so I don't want to ejaculate. But that is not wrong. Initially, even though you have pain, you have to ejaculate. After 2 to 3 times of regular ejaculation, pain will start coming down, because the inflammation also will come down. So frequent ejaculation, at least 2 to 3 times a week, is must. Otherwise, treating chronic prostatitis is very difficult. So these are the medications, common medications what you have to use for chronic prostatitis. In spite of taking these medications, if your symptoms are persisting, then go to a local doctor and get it treated. And don't forget to take at least 2 to 3 liters of water when you are on chronic prostatitis medication. Thank you.